right, Dr. Valencia, thank you so much for being a guest on the Holistic Hub podcast. I am so excited to interview you.
Thank you, Dr. Peacock. I'm super excited to be interviewed and to share my information to your podcast. So I'm excited.
Yay. Well, the listeners don't know this, but Dr. Valencia and I go way back. We first met as colleagues working at the Water Fasting Center in Santa Rosa, California. And we just became fast friends there. And I learned all about her and like the work that she does with her patients, which involves traditional Chinese medicine and acupuncture and so many wonderful modalities that we are going to dive into today. But first, I love to start with just asking, what got you started in naturopathic medicine and ultimately leading you to want to incorporate acupuncture and some of these other modalities in your practice?
Yes, so when I graduated high school, I joined the military and I was a physical therapy assistant and an emergency medical technician. And I decided to leave the military. So at that point, it's like, what am I going to do? And a friend of mine, a supervisor, was saying, oh, I've heard about this amazing thing called naturopathic medicine. And they printed out a little brochure, read it, and I was like, wow, that's amazing. And during that time, I was finishing my undergrad in cell molecular biology. So I was mostly research-based at that time. And I, at one point, was thinking of doing more research. And during that time, my mom got diagnosed with acute lymphoblastic leukemia. It's a pretty aggressive cancer. And it shocked our whole family. So at that point, we're just like, okay, what do we need to do for mom so she can survive, chemo and everything that's going to happen. And that's when I remembered about naturopathic medicine. So we looked for a naturopath locally in our community. And we went ahead and did everything that they told us to do, from removing all our household items, what my mom's putting in her body, incorporated supplements. And so she was really, I think, honestly, I believe it was the complementary approach that helped my mom overcome her cancer diagnosis. And during her time of getting chemo, I just noticed that there was something about her that was off. It's that sparkle in our eye, that kind of who we are. And during that time, that's when I was looking into acupuncture and the benefits of acupuncture. And I myself started to get acupuncture, and I was like, oh my gosh, this is amazing. Yeah. And so then I was like, I'm going to do this. And that's where I went ahead and applied for naturopathic and acupuncture school.
Oh, that's amazing. Thank you for sharing your story. So according to traditional Chinese medicine, why is it that illness does occur in an individual?
Yes. So illness so Chinese medicine looks at the body, at the person holistically. So it's looking at the mind, body, spirit connection. So that's what are the levels that cause illness. So it could be environmental, or I'll start out externally. So that's like the weather, if you're exposing yourself to cold environment, or if it's too hot of an environment or dry. So it's, so weather related. It could also be infectious. So, parasites, it could be a factor from that too. Another option is internally. So that's how you view the world. That's how I kind of explain it to patients. So that's how your emotions. Are you not expressing your emotions? Are you having excess emotions? Are you not even connecting to your emotions? So in Chinese medicines, those are broken to like 5 categories. So like anger, excessive joy, worry, grief, and fear. So I explained it to people, you should be able to feel all your emotions, but you shouldn't be stuck in them. And when you're stuck in them in Chinese medicine, it creates a difference in your energy. So we call it qi. So your qi could get scattered, it could just not move, and that can create stagnation, or it could, deplete it. So there's different ways how we use it. So like the philosophy of Chinese medicine is looking at qi, and the way that I described as to people, we're all energetic beings, and we know that. So we have an energy frequency, and our energy is based on how we're on health. If we're healthy, we're vibrant, we're enjoying life, and we have great connections and relationships. And when we're not, then that's affected. And going back to your question, so besides emotions, it's your constitution when you were born. So when your parents when you're born from your parents, you have their chi that they gave you. So that could be strong and vital, or it could be maybe depleted. And you have like a weak constitution. And with people with weak constitution, they're the ones that like, yeah, when I was a kid, I would always get sick, or I really have to take care of my health, because their constitution isn't, it's not normal for them. It's just weaker just because of what was passed down through their parents. And then the chi that you make is through your food, how you move your body, if you're sleeping. So that's what we call postnatal chi. So that's another way. So we're looking at, are they, like, is a person overworking? Are they having too much sex? Are they doing, recreational drugs or over medicated? Are they stressed out? Do they not have good relationships? So those are all how health affects you in Chinese medicine.
That's amazing. So it sounds so individualized because, again, you're saying it's the chi that you get from your parents, and then it's also your constitution. There's the environmental factors, and it's the chi that you make. And then is that aligning then with like the life that you're leading, or maybe the people you're surrounding yourself with, or the food that you're eating, the type of exercise you're doing? Is that kind of the notion? Am I kind of going in the correct line? Okay.
Absolutely.
So that's amazing. So then maybe this is a good time then to dive into the 5 pillars of Chinese medicine. So I'd love for you to kind of mention each of them and like how they would impact like a patient of yours that you would see, and like recommendations that can typically be made alongside each of those. And if you even make recommendations within each category too, I'm curious if you tend to use all 5 pillars, like when you're working with somebody.
Yeah, absolutely. So the 5 pillars are herbal. So those are herbal decoctions that we normally prescribe. And that's based on if it's like an acute situation, or if chronically, if you're, if you're treating somebody. And it's customized, again, like you just very individualized. So I know we'll talk about it later, but it's, are they deficient? Are they excess? Is there some dampness? Is there stagnation? So the formula is based on, do we want to move energy? Do we want to try to build energy? So that's how herbs come into play. And then there's different forms of body work, but Tuina is a common one. And it's a therapeutic massage to help alleviate pain. And it helps balance qi by working on the meridians. So the meridians in Chinese medicine, those are like your highways that connect your organs. Yeah. And so that's what they're feeling in the body. So it's, well, I know we'll discuss it, but there's the Western approach is like, oh, that's totally fascia. It's the dopamines being released, neurotransmitters when we're working on the meridians. And in Chinese medicine, it's mostly what we're looking at is deficient excess. Where's the blockages? Where's the qi being moved? So the analogy I tell people, it's a river. You want your body's water sources to be moving. You don't want dams to be stuck, because then that blocks your energy. So that's Tiwina. It's more like acupressure. You're putting your fingers, your hands on the body, holding it, and moving the body and providing pressure in the body there. And then dietary approach, we're looking at, it's focusing on, again, is there a problem with is there a lot of dryness? Or are they eating, like, for example, people like that love salads, but their constitution is weak. They don't have that digestive fiber to be able to process it. So then they don't assimilate it. So it's like, well, and they're like, but I want to be healthy. It's like, well, eat more cooked veggies would be yours for constitution and based on like your pulses. So I am dietary is super important for me. I know that's one thing I do recommend for my patients. And then another thing, it's Qigong, which is and exercise and movement that focuses on breathing, being present, and helping again or moving the meridians. And then the last one is acupuncture, where you're putting a small little needle, like about the size of your hair, in different points of your body to help regulate qi, alleviate pain, and restore balance. And with all those 5 pillars, it's individually based. Yeah. But you do, like in my approach, I definitely, every time I do at least a qigong movement with them. So I give them exercises. I was like, you got some work to do. And then we do, obviously acupuncture and then diet are the big ones. And you don't need to do all 5. And it's, when at the end, as an acupuncturist, we're looking to see how did the body change? How did that qi change? And how much support it needs after. If it needs more support, it's like, oh, yes, absolutely. You're going to do like herbs, diet, qigong, and acupuncture. If their qi is just doing well, like if it's somebody that's like, hey, Dr. Valencia, I'm moving my body, I have great relationships, I'm managing my stress well, because we all have stress. It's never going to go away. And they're eating well, and it's like, oh, great. And like for them, they might just need acupuncture, and then I might just do a little bit like qigong, and there's situations where they need a little bit support in. So,
oh, amazing. So I'm curious then, when it comes to understanding the element type, so the differences between like wood, water, fire, earth, and metal, does that play into the constitution, or are those 2 separate things in understanding like what makes this person unique?
No, that's a great. So when I'm looking at somebody, yes. So the first thing, we look at the person. And then from there, it separates it to the yin and yang. So that could be your feminine, your masculine. So that could be your excess and dryness. So you separate it to that. And so mostly, and then after that, what you were talking about is the 5 elements. So those are your 5 elements they're similar to your emotions and your organs. So for example, the liver is associated with the wood element, and liver is about growth, flexibility, movement. So if somebody in their life is, being mindset of being super rigid, or they're not moving, they're sitting all day just because of their job, then that just creates the liver to have some imbalances. Okay. So then at that point, you're just like, okay, let's help support the liver by recommending, hey, get a standing chair, or in between breaks, you should move your body, or you could do foods that are more helpful to support your liver. So that's what you would look for.
Okay, amazing. Thank you for clearing that. So then when someone comes in to see you, when you're assessing that person, you kind of already touched on this, but what is kind of like the step-by-step approach that someone in the field of traditional Chinese medicine would then take? So by understanding like their qi and their constitution, and then overall understanding like the elements.
Yeah, absolutely. So when somebody comes in, the main thing that we're looking at is we're looking at just observation. So that is what we call their shen, just like their overall, like how are they looking? How is that like light in their eye, reflection? And so through observation, and then the other parts we do is through physically feeling their pulses, and we're looking for quality. We're just also looking for, is it excess, deficiency in the shape of the pulse that we're looking at. And tongue, we're also looking at color. Is it dry? Is it moist? Is there, there's different zones in the tongue associated with different organs. For example, the tip of the tongue is associated with any heart imbalances. In the center, any liver, gallbladder spleen or stomach imbalances, and then in the sides it's liver, gallbladder imbalances there. And then we also palpate the body to see like, hey, where is there, is it distributing? Is there softness? Is there tightness happening in there? And then we also, can palpate the abdomen looking for any kind of imbalances that are occurring within the organs. So those are like the five elements and deficiency. So we're always looking for deficiency, excess, and any other imbalances within the five elements, which is wood, water, fire, earth, and metal.
And can you kind of go into it a little deeper with the five elements? Like explain, we touched on the liver, but can we talk about some of the other elements and like how those can show up in the body?
Yeah, this one's like my favorite, and I love it because it's ways to kind of give people guidelines. With Chinese medicine, we talk about like eating within the season, and depending on the elements, you could do that. Like for woods, that's when you could have more of like the salads there, more of the greens. That's kind of more of the wood element there. And for example, water is associated with kidneys, so that's cold, stiffness, like so a lot of exposure to cold and stiffness. And the emotion is fear. And so if there's like a lot of fear, you're not nourishing, and you're like over, go, 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 burning candles on both ends, that's affecting your kidney chi. And some of the symptoms people could have is like fatigue, urinary issues, low back pain. Anxiety could be a problem too. And so the biggest for the kidneys is eating foods that are actually more salty, because that's the flavor, salty, for the kidneys. So that's when I'm more of like, hey, let's go ahead, get some like celery salt, some kale.
Yes.
So kelp, get those nice, good, nourishing foods that have that natural salt in them. And the next one would be the fire element. So it's associated with the heart. It's about transformation, about warmth, about connecting with an individual, communities. And when that's in balance, you could get insomnia, palpitations, emotional instability happening. And the best way to help strengthen the heart with foods is through bitter foods, could be very helpful for that. And some herbs, doing mindfulness practices too can help. Okay. And then for the next one we'll talk about is earth. So that's your spleen and stomach channel. And spleen and stomach, it's more about stability, nourishing, feeling safe, like you're home. And when there's imbalances there, you could get bloating, gas, digestive issues, and it could be from excess worrying. That could also throw your spleen into imbalances there. So the things that spleen, to strengthen spleen, it's like sweet foods, but not overly sweet, because if you do too much sweet, that causes more dampness, which the earth is prone to. So that's more like when I'm like talking to people, it's like eat more sweet roots, and like yams, squashes. They have that sweetness, but that nourishing in there too, that the spleen can benefit from. And then lastly, there's the metal, which is your large intestine and your lungs. And it's about contractions, purity. It's about, having, appropriate boundaries, because I think sometimes we might not have boundaries. That's like the metal there. And the emotion it's associated with is grief, and some of the physical symptoms that could come up is like respiratory issues, constipation, any kind of skin issues. That's usually related to the metal organ. And usually the food that helps support metal is spicy, so pungent foods. So that would be another thing that they could focus on.
Very, very cool. So you have been talking about like when you see somebody in your office and you're assessing them, when you're palpating the organs, that's when you can kind of get a sense for maybe where these five elements like might be occurring, like what might be deficient or might need some more support. So I'm just out of curiosity, because a lot of what you're describing too are symptoms. Like if you're working with someone, over telehealth, can you also kind of get a grasp for that person's like five elements, like what might be going on in their body based off of just symptoms alone? Or is it usually best like in person to really assess?
You could go through symptoms and through like their observation. So I wouldn't, in this part, if it was telehealth, I obviously wouldn't be able to check their pulses, but I could at least look at their tongue and at least just observe, give an observation and then ask specific leading questions that could help me determine what it is. Like, for example, if I was suspecting somebody that had like a liver imbalance, I would ask him like, how much movement are you getting? Are you getting headaches? Because that's a liver problem that could happen. I would say is like, do you feel like you're wounded up and you're not expressing yourself? So I could ask questions that could help me figure out which element they might be stuck in and that might need support.
Awesome. Well, I love how you keep touching kind of on the tongue diagnostics. I'd like to dive a little bit deeper into this. So you kind of did touch on it a little bit, but can you tell us a little bit more about how, like the different areas of the tongue, like how it can really, like, does it relate to every part, like every organ in our body, or just to some? And you mentioned like looking at like the color, the dryness, like how are all these factors playing into like what tells you like what's going on with that person?
Yes. So, no, unfortunately, the tongue doesn't do like what you're asking for regarding like if it shows every organ. That would be your ear actually, which is auricular therapy, and it's super awesome. It's great for like kids, for elderly, because it's super gentle, but it's very profound. The tongue specifically does mostly what we call the solid organs. So it's the five elements again. So it's telling us about heart issues, any kind of lung and spleen, and any liver issues that are happening there. So I'll walk you through it. So when somebody sticks out their tongue, I'm looking at the color. Is it pale? Is it red? Is it dark red? Is it purple? And then I'm also looking at the shape. Does it feel swollen? Is it too thin? Do I see little ridges of teeth marks on the side? Is there a crack in the center? Like all that is telling me, giving me information.
Okay.
And then the coat of the tongue. So the coat, we all should have a nice little coat on top of our tongue. But if it's too thick, or if it's yellow, or if there's no coat, or if it's white, then that's when you're like, okay, there's something's happening there.
Okay.
And then also the moisture that we're looking at it too. So the coating, it's just on top of it. Moisture is like the overall tongue. Is it glistening? Is it moist, or is it completely dry? And then, like I was saying, so when somebody sticks out their tongue, I'm looking like, okay, the tip is related to the heart. The center is your spleen and stomach, sides, liver, and gallbladder, and then the back is your kidneys. So I'm looking to see, because you can see some subtle variations in there. So somebody, for example, that's had chronic anxiety, usually the tip of the tongue is slightly red. You see it. So you're like, okay, they've been having a lot of heat in their heart channel. So that tells me there's been a lot of anxiety going on. And if they've been having a lot of digestive issues, so the middle and the center, you normally see like a little crack in there, or you sometimes see little like fissures, or the coating could be a little bit more yellow. So those are some examples of kind of what you're looking for.
This is so fascinating. Like learning about all the different areas of the body that can just tell you so much just in that like first probably like 30 minutes that you're working with somebody about like what they've been through without them maybe even telling you themselves.
Yes.
So I'd love to just, I wasn't going to ask you about this, but since you brought up auricular therapy, it's just so funny because I remember when we were at True North Health Center, and I'd see people walking around with the little beads that was providing a little pressure on their ears. And I was like, they saw Analila or Dr. Valencia. And so could you briefly just talk about, you mentioned that, yes, so the ear has, the meridians or the energy flow to every different organ in the body. So the treatment for it then is providing little pressure points to those areas to provide support, or is there something more to it as well that like you might also do, like, because you could probably do acupuncture with it as well. So what are the treatment options for it?
Yeah, so for auricular therapy, you could put essential oils on there, like topically in that
Ah,
area. You could put needles in it, or yeah, a little like radish seeds, or there's some metals you could do. There's different philosophies in acupuncture, like gold, it's
cool.
more tonifying seeds, or you could put seeds that are silver. So those are more for like excess, and copper's more neutral. So those are different colors of or metal varieties of seeds you could put, and it works for everything because it is literally the ear reflects the human body upside down, and so there's internal organs there, there's bones, there's musculoskeletal areas you could
Wow.
do, and I really when I did my residency at at True North and actually at the Cancer Treatment Centers of America, I was working with oncology patients, and a lot of it is they're already so depleted that you just don't. With when you put
Yes.
metals, their life force has to be strong enough to make those changes that we're suggesting with the needles. And when we're putting the ear seeds, it's more of a gentle way of telling the body when they're pressing the ear,
Hmm.
it's telling it, hey, let's focus on these areas. Like let's see what's going on.
Okay.
So that's what it's doing. It's just kind of reminding the body, like, hey, there's these areas that there's not a lot, there's imbalances. Let's see if we could clear that out.
I love it. Thank you for, yeah, touching on that. That's so amazing. And so I think this would be a really great segue into kind of diving a little deeper into acupuncture, because this is, again, something that I have found like numerous times to be so beneficial for my clients or people I'm just chatting with and myself personally. So would love to dive into it more. My understanding is that it is moving energy that's already in the body, that it's not adding to it. And so would you be able to dive a little bit more into the acupuncture side of Chinese medicine, and then what conditions that you have maybe seen it work best for?
Yes, yeah. So acupuncture is moving energy in the body. So that's what so the philosophy is if there's any blockages that's preventing other parts of the body not getting the nourishment and what it needs. So we're removing those blockages, and that in itself is what's helping the person's other organs that were
Yes.
deficient receive that energy. And moxa is another form. It's a mugwort is the herb that some acupuncturists use to try to help build energy and tonify.
Okay.
So those it says they would apply it topically, or they could put a little wand over the skin, and it has a smell. It's a dried plant that
Okay.
they'll put on people, and that helps with tonifying the body. And regarding acupuncture, it's been shown, like I'll discuss it in the Western perspective first, that it's been shown to help with reducing pain, and they think potentially because it's releasing endorphins in the body. And then with the nervous system, it's they're thinking potentially it could be related to the muscle and the fascia that it's helping there. And some of the other reasons they think it's for, like, when you're inserting the needle, maybe that's creating, the little hole is creating circulation and bringing blood to that area. So those are some of, like, the reasons. Or like, well, it could be circulation, it could be hormones, it
Yeah.
could be neurotransmitters. That's why acupuncture is being affected, and that's the
Yeah.
kind of the more Western approach of science of trying to discover how exactly is it
Yeah.
working. uh, and then for us, it's mostly I look at it again more. It's like you're trying to balance their body in a way that the body has wisdom and what it's doing. It's pretty brilliant. Just like when we cut ourselves, we don't tell the body what to do, right? We just
Yes.
put a band-aid and make sure there's not an infection. But your white blood cells, they're the ones that are like, okay, we need to repair the cells. We need to, make sure we stop the bleeding and create new skin tissue. So the body has that wisdom. So in Chinese medicine, we just allowing them, reminding the body when there's imbalances of what it needs to do. So so things I've seen it definitely for any musculoskeletal pain. It's very helpful for people that are anxious and their nervous regulatory system and is just very imbalanced or really wounded up. It just like helps the body like it's safe. It's gonna be okay. Let's take a breath. So definitely, it helps for anxiety, depression, people that have insomnia or any gas or bloating, because like irritable bowel syndrome. That's like a lot of related to mental, emotional things that are happening. Could be very helpful for too. It's like the laundry list is great, but like mostly what I what I see is it because it not only affects the nervous system, it affects so many other organ systems. It can be helpful for pretty much anybody that's having some health concerns. So I say everybody should be getting acupuncture.
I know, it's just so all encompassing. It's amazing. And I love that you keep bringing it back to the nervous system regulation side of things, right? Because, we just live in an increasingly polluted world where there's like not only just like stress in our day-to-day life and our jobs and maybe some relationships, but it's what chemical stressors we're getting exposed to that are affecting our body. Even if we're not feeling stress, like our bodies might actually be stressed from this toxic load or whatever it is we're getting exposed to unknowingly or knowingly. So, and so it all, I always tell people this, we got to get the body to feeling safe again. And, because the body is so smart and has so much wisdom, like you said, if it's feeling threatened by its outside environment, then it's not going to be feeling safe and then can have those downstream effects of creating inflammation or blocking energy or anything like that. And so it sounds like acupuncture is such a wonderful way to help re-regulate that nervous system and tell the body, hey, it's okay. Like things are okay. And that would explain so much of why it seems like many people that are struggling with stressors in their life, again, whether it's emotional or physical or chemical stressors, that they feel so good and it helps to really balance them when they get acupuncture. And I'm assuming that's probably what you see after you work with people with the nervous system side of things. Yeah, that's amazing. Well, kind of leading in then to talking about maybe chemical load, toxicity. So a lot of the clients that I work with are struggling with mold toxicity. And so I know a lot of people would love to hear the answer for this is, have you found then maybe somebody that had some form of mold exposure or any type of chemical exposure, creating any type of toxic load in their body? Have you found acupuncture to maybe help support those organs, those detox organs, and it's helping the nervous system? So in a way, it's helping to detoxify or help support them through that. Have you found that to be helpful?
Yes, I have. And the main thing that we're looking into, like you said, is supporting the detox organs. So that's like making sure the liver meridian, kidneys, lungs, and spleen, that they're doing their jobs on eliminating toxins, and also strengthening the chi in their blood to make sure that that's balanced. So that's through, definitely through acupuncture and then recommending herbal treatments based on that. So with any kind of chemical exposures in the body, usually we look at that as being a dampness that happens in the body, like damp toxins. So the parts that we try to do is to, you want to clear them out. The philosophy is like clear them out, make sure you help the body eliminate them too. And, so we're trying to neutralize it. And then also by doing that, you're also wanting to nourish the body in that process too, right? Because through some chemical, for example, the chemical exposure was affecting the body and it was creating more heat. So you want to make sure we reduce the heat or clearing it out, but also tonifying what we call yin and making sure that the body has enough blood and chi to be able to do that, and it's not getting too depleted in the process of that exposure.
I love that you brought that up. It's, it's not just one thing. It's focusing on other supports too, because of what those chemical or environmental exposures can have on the body. Like from that perspective or nutrient depletion perspective, there's things that our body has become deficient in at that point that needs some support. So I love that you brought that up. That's amazing. So you mentioned earlier how you were saying that you think everyone should be getting acupuncture. And after this conversation, I 100% agree. So how often would you say like someone might need to be getting acupuncture? Then I'm assuming it probably differs like per patient or like what's going on with them. But is there like maybe like a happy medium that you found to be like a great amount of time that somebody should be getting it?
Yeah, so it did, absolutely, you're right. Everybody should get it, but it depends on what's the situation. So some people that are like super sick, and it depends like how their constitution is. So usually after an acupuncture treatment, I always check their pulses again and see how they're doing. And again, looking at their whole body to see how they responded. So like, let's say I did a treatment and they're like so wiped out and it was like, whoa, they so relaxed.
Okay.
And then they're like, oh, Dr. Valencia, I went home and I slept the whole day. I was like, okay, that's, but it felt amazing. I was like, yay. And I was like, okay, that was too much for you. We need to do less. So it all depends, but just like as a general guideline, I usually say, so somebody that for muscle pains, like I'd say they pulled their back out or something, or they, they twisted their ankle. So they want to be seen at least twice a week, and they'll probably be that for maybe 2 to 3 weeks. And then after that, they could go, depending on if there's other health concerns, they could just not need to get acupuncture. Or just like, hey, yeah, I just noticed I'm having problems with, bloating or gas. So those type of, like if it's more of an internal chronic condition, that would be at least, could be once to twice a month, depending, kind of how things are going with them. And for somebody that's just like, hey, I just want to do wellness and maintenance, those, like I would say just once a month or even every like quarterly, just to kind of do tune-ups. Okay. So it depends on where a person's at, and it's also how much they're committed, because I tell them when I'm seeing them, it's like, okay, well, these are foods that I'm recommending. And one thing I didn't touch up on with the diet part is I also talk to them about like steaming their foods and like eating within the seasons. And if they're like, that's not going to happen, like I have to, like most of my food is eating out because of my traveling, then it's like, okay, you might need to come more frequent, because what you're putting in your body is so important. Yes. But also like not only eating, but topically, like drinking. So like, they're like, yes, I got clean sources of water, I'm eating good, healthy, and I'm moving my body. It's like, you're more for maintenance. If they're like, oh, I'm sleeping poorly, I'm eating really bad, it's like, okay, you need to come at least once a week. And then if it's acutely, it's like, okay, let's do it twice a week. Okay. We're just going to try to get you out of your acute phase, and then we'll reassess. Does that help?
Oh, no, that was perfect. That was such a great, that's great to know, because, there's all kinds of recommendations out there for any kind of treatment plan. And it makes perfect sense. Like the more acute, the more often. And then like if it's maintenance, like that was really cool to hear that it's once a month or maybe even quarterly, or if it's wellness, like things like that. Like that's really good information. Cause I personally didn't even know like how often someone should probably be getting it. So that definitely answered it. Thank you. And I'm curious, how long are each acupuncture session? Does that also usually vary per person, or are they usually like, is there a certain amount of time that's best to keep the needles in?
So I'll tell you that I'm a little bit different when it comes to holding, like maintaining needle hold. Okay, let's try this again. So regarding your question of how long acupuncture needles are in the body, it depends. So somebody that's a little bit more fragile, I tend to do less time, so about 15 minutes. And then I tend to do more like essential oils and tuning forks because it's more gentle for them. Versus if somebody's fairly healthy, robust, I'll usually have the needles in for 30 minutes to 45 minutes. And again, in between the acupuncture, I'm checking for their pulses to see how their body's responding. So if I feel the pulses feel great, then I take the needles. If it's still trying to regulate itself, then I'll either put another needle in or just allow them to rest a little longer.
That's great. So again, super individualized, which is great because that's important because, I think sometimes like if you're like looking online for a local acupuncturist or somebody that can help, like you typically see like the sessions are always around 40 minutes or 45 minutes, or you see like a timeline that's absolute every time. And so I've just wondered if there's, like a specific amount of time, but I love that, again, it's individualized per person. And then it's not just acupuncture, like they might need like some other supports too, if like they need something a little more gentle. So I think that's really great information for people to hear and to maybe look for when they're, looking around for somebody local to work with. So that's really important. I love that. So what herbs then, I'm curious, do you recommend for stress and nervous system support? If you see somebody, because again, a lot of my listeners are dealing with, chronic toxic load, mold toxicity, mast cell activation, nervous system's dysregulated. And I'm curious, like paired with acupuncture and other supports, dietary supports that you're going to be adding in and other things, what are maybe some of your favorite herbs that you've seen be very beneficial for people?
Yeah, and that's super important. And I'm going to do a little tangent here. That especially with Chinese herbs, unfortunately, you have to be super careful because there has been some lead that some people have been doing Chinese medicine and they have been exposed to lead. And so you definitely want to make sure that the source you're getting it from and your acupuncturist is making sure that it's third party tested, so that there is not any other environmental toxins in there. So that would be the foremost one, so to make sure, because I think sometimes even as practitioners we need to do our due diligence to make sure that the companies that we are purchasing from, that they are third-party testing. And so that's why I'm very selective when I do herbal recommendations. And with herbs, and I know this question, it's a little tough because I think sometimes we tend to just, there's research and they're like, oh, this herb is great. And we all want to purchase it and try it and see what it does for us. And it's actually so with Chinese medicine, it came through, it's through formula. So it's not one herb, it's a formula that is recommended based on the individual of what we're trying to accomplish. Yep. And each herb has a specific role in there. And so it's hard to just be like, oh, just do one. So, it's super hard to say it that way to answer your question, but if I was kind of thinking about that, and I would say, like we've all heard of licorice root and, ginseng to be, very helpful for nervous system. It's the great adaptogenic herbs. So those are like what some people would start off with, but it's really based on your practitioner of what they think is going to help, because is it nervous system related too, because of you're having a lot of anxiety, that's a totally different herb than if you were having, nervous system issues because of your spleen and stomach were imbalanced, versus if you're having nervous system issues because of, liver, gallbladder. So it's based on herbs and that communicate with each other. So when I was in naturopathic school, they were doing research on I forgot what machine they were using, but it's like a chromatography where they're look at the fingerprint of the herb, and they did one with the formula. So it'd be kind of like, hey, how does it look just with the herb, and what about the formulas? And the gentleman that was doing the research, he said there was so much more I'm going to use the word synergistic communication and signature when with the formula than the herb by itself. So that goes to just the beauty of like nature is it's about how it communicates, how these herbs communicate with each other to create more of a better outcome for the person that's consuming it than just taking that herb by itself.
That was so beautifully said, Dr. Valencia, because again, I love exactly what you're like, the message that you're getting across is like that synergistic effect that things have together and how that has such a beautiful, profound effect on our bodies, the way nature had it. And it's almost like relating it back to food, which is why I can see why dietary therapy is one of the 5 pillars, because again, food is medicine too, like you've been touching on. And that again, like we can talk about a kiwi, for example, like taking vitamin C alone, or taking like a kiwi has such a large amount of vitamin C too, and eating that with the fiber and all the other nutrients works so synergistically as well. And of course, herbs and all these supports that the formulas and things are going to be absolutely necessary in different cases. But again, it's like not forgetting where they came from and the source, and like how important that is, like finding it as it is to be so helpful in that individual. So yeah, I love that.
Yeah, absolutely. Yeah, and because it's pretty cool, because in herbs, the herbs, for example, we're looking at, is it cooling? Is it drying? Is it moistening? Is it heating? And so it's kind of like a little symphony that you're creating with the formula, which is so cool.
That's cool.
So if you just do one herb, if it's, cold and bitter, then it's going, and if you take it long term, then that's going to accumulate a depletion. So then the person's going to not be, then their yin and their yang's going to be in balance, and then that's going to create further problems. But by you doing like a symphony of different herbs that communicate, then it's more gentler, and you don't have that long-term risk of them potentially causing their chi to get imbalanced by just doing one herbal.
I love that. Yes, it's like, what do we do to maintain that balance in the body? That's really important. Is we don't want to like tip things in the, too much in the wrong direction or in any direction, but any direction would then cause a deficiency in another direction. So we want to make sure that we're keeping things nice and balanced, which is amazing. So, what's really great about chatting with you is that it was 2 weeks ago, I actually had just interviewed Dr. Judy Morgan, who's a holistic pet veterinarian, and she utilizes traditional Chinese medicine as well. And we didn't dive too deep into it, but we were talking about the use of it with animals too. And I thought it was such a fun conversation as well to talk about it with pets. And I don't think I've told you yet, but our cat Samson, we actually have a holistic vet, not her, but somebody else that has been using traditional Chinese medicine with him as well, and like provide exactly what you mentioned, like the formula based off of like everything that we were talking about. And it was just really cool. So everything you're saying, I have seen through our veterinarian. So my last question here regarding that is, have you ever worked with pets before to just to get an idea? Like, has anyone brought in their pet to you just to kind of get an idea of what's going on with them?
Oh, I would love to do that, but unfortunately, I can't do acupuncture on pets because I'm not a veterinarian. But I can. I have done it on my dogs and friends, and it's amazing. It is so amazing because I think some resistance sometimes in our American culture is that we try to understand everything, and this invincible energy force that I'm calling chi is like, what are you talking about? It's like, so they have that mental blockage. And animals, you don't have to explain it, and you just do acupuncture, acupressure, and they're like looking at you like, what did you just do to me? This is amazing. And it's so amazing, and they respond so well to it. Actually, I was petting one of my friend's dogs, and I was like, "Ooh, their lung meridian is going on." It's like, are they having allergies? Like, there's something going on here. You need to take them to a vet.
Oh my gosh.
So yeah, it's pretty amazing too. Yeah, I absolutely. Pets can be very benefit. They can get a lot of benefits from getting
Oh, that's amazing. Wow. I feel like that was such a great way to kind of close out our conversation is, we talked about so much incredible information and we end with talking about animals. You can't end a conversation better than that. I always
Exactly.
like to leave it to you. If like there was anything else that you wanted to mention that maybe we didn't cover today or that maybe you forgot to mention in one of the questions. And then on top of that, where people can find you or work with you and if you offer telehealth consultations as well.
Yeah, thanks. Yeah, I had a great time. And yes,
Yay.
animals are amazing. I guess I didn't hit when I was talking about causes. I think a big one, and especially in my
Yeah.
practice, is that our relationship and our community has, I think, suffered a lot. So I encourage people is to have that, that to create a community that is helping them make connections. It's very interesting because I think we're in a world of technology and it's amazing and it has helped us. But just having somebody in the same room as you, like I've had
Yeah.
people be like, your homework is to hug somebody you care about for a minute.
Oh, that's
It's
amazing.
so important that community. It's because it's the energy we synergistically send out is so important, and we receive that. It's through our endorphins, our hormones, and the smell, and so I would say it's like definitely go out in nature. If you have a pet or a friend, hugs, touches. I think we're not doing therapeutic touching enough,
Yeah.
and our skin is such a big organ. So like, just taking fresh breaths in the forest, and giving your partner, like I said, a minute hug, petting your
Oh,
dog or cat. It's so important for us, and that helps our nervous system so much. So, and that ties back to community. So we know if you don't have, or you don't think you have a community, you have so much risk of depression and anxiety. So it's like, hey, start calling somebody and be like, let's eat together, let's read a book together, something that's gonna, help you be in the community is so important. So that's what I would say. I didn't emphasize that enough. And as far as for myself, you could find me in my website. It's drAnalilavalencia.com. And yeah, and I do telehealth and I do in person. So
awesome. And you're located in Santa Rosa, California. Is that where your office is?
yes, actually it's Sebastopol, California now.
That's right. I forgot you changed there. Amazing.
Yeah.
Oh, well, Dr. Valencia, your patients are very lucky to have you. And thank you for sharing your wisdom and knowledge with me and with the listeners. And I know everyone's going to absolutely love this episode. So thanks again for being a guest. It was such a great chat with you.
Thank you, Dr. Peacock. I loved it. And thank you for having me again. And I had a great time. And I love your plant in the back there. I'm a plant mom, so thank you.
I knew you would love it. Thank you.